Hi, I'm Dr. Raj Sinha. I'm an orthopedic surgeon specializing in hip and knee replacement, practicing here in Palm Desert, California at Star Orthopedics. I've been in practice for 22 years, the last 16 here in the desert. I've had the good fortune of being involved in designing implants for several different companies. And I want to tell you a little bit about how we got to a custom knee replacement. One of the most common things that patients ask me about is pain management after surgery. People are in excruciating pain going into the surgery, but the fear of the pain after the surgery is really what keeps them from having the surgery. In fact, there's been some research done that only 1 out of 3 patients who would benefit from a knee replacement actually gets a knee replacement. And the reason that the other 2 don't is because they're afraid of the operation. They've heard horror stories. When it comes to pain management, there are several things that are very important. The first thing is that we want you in your optimal medical shape going into surgery, which includes physical shape. So if you can do physical therapy ahead of time, that's beneficial. The stronger you are going into the surgery, the quicker your recovery coming out. The second thing is something we call preemptive pain control. Most of the medications that you've heard of, like the opioids, the Vicodins, the Percocets, etc., don't really treat the cause of pain. They just make your brain forget about the pain, and therefore you don't care about it, and so you feel like you have pain relief. But if you can prevent the pain from actually getting to the point where the brain is receiving that signal, and if you can prevent the source of the pain, i.e. the inflammation and the swelling from the trauma, then you're ahead of the game. And so that's what we try to do. We do it several different ways. We give you medicine ahead of time before we even do the operation. That starts to precondition your nervous system not to get so upregulated and on fire whenever the trauma of the surgery occurs. The second thing that we do is that we do peripheral nerve blocks. So we actually block the signal from being transmitted from your knee to your spinal cord to your brain, so that your brain never gets the message that some trauma has occurred. And we can also use those peripheral nerve blocks in long-term delivery of anesthetic through a pump that can last for 48 to 60 hours and essentially blocks 80% of your pain. The other thing that we want you to do is take anti-inflammatory medications. People always say, oh, well, Advil doesn't work for me, Aleve doesn't work for me. But we're not looking for it to be the sole source of your pain relief. We're looking for it to control the swelling around your knee, because the swelling is a source of pain. And so we can control the swelling preemptively. That really helps. Same thing with Tylenol. Tylenol blocks transmission of a nerve signal to your brain. So we want you to take both of those medications, whether you have 0 pain or 10 out of 10 pain. We want you to take those medications on a regular basis. Ice is very beneficial. Motion is very beneficial. Both those things help control the signal transmission to your brain of pain. And then lastly, physical therapy. We want you to do physical therapy to get the motion back, because if you don't do that, you get stiff, and then you create a whole new pain pathway that has to be dealt with. So if you attack all those different areas and stay ahead of your pain, the recovery can be quite enjoyable. In fact, most of my patients are off narcotics by 2 to 3 weeks after surgery.